I might just get your reaction, first of all, to schoolies being cancelled. It seems a pretty cautious approach again, but when you see some of the pictures of schoolies, it's hard to see it being COVID safe. Is this a fair call?
I can understand where the Premier's going. The challenge will be schoolies is never an event. It's just an aberration, an activity. Young people descend upon it. And whilst the government and the council have done some really good work to try and create some order, it will be interesting to see if Queensland's young people actually follow that advice. I hope they do.
So, what you're pointing out is, I guess there'll be fewer people regardless, given the people not allowed from New South Wales and Victoria at the moment. But for people in Queensland, you can't ban someone who's 18 and, ready for some revelry from flying somewhere and celebrating. Right?
Correct. I went to schoolies in the Gold Coast when I finished school in the late 80s, and there was no events planned. It was just what young people did. So that will be the challenge for government and council. The trick will be for young people to do the right thing if they do come post-school.
Well, it must have been an interesting time. Are a few stories out of that particular trip, were there?
Well, 1987 was a great year.
You want to leave it at that?
I think we'll move on.
Let's talk about your responsibilities now. So more changes in the NDIS. What are the key changes for those in the program?
The big change we announced in November last year, so we started the conversation almost 12 months ago, but moving towards the original scheme design of independent assessments for access and then full flexibility within a plan, putting aside some home modifications or specialist disability accommodation. So what that means, if an Australian is seeking access, rather than having to get therapy reports and negotiate with planners, which can be quite stressful at times, here independent assessments by world-leading professionals that will look at the functional assessment, what function you've got, and that, of course, will give you access, and then full flexibility in your plan.
Autonomy, basically, making decisions, and this is how you mentioned the scheme was always supposed to be.
Correct.
Why so long until it was able to be enacted in this way?
Well, the Productivity Commission always recommended that functional assessments should be the basis for access. That wasn't taken up when the legislation was put through and the previous government started it.
That's a lot of years ago, though.
It is a lot of years. So the focus was on getting participants through, 400,000 participants now. So a real focus transitioning from the states to the Commonwealth. So I asked Mr Tune to do a review, 29 very good recommendations. So now the opportunity is to finalise the original design of the scheme.
The wait times are down, but still, so it's 67 days on average to achieve a plan. Is that low enough yet?
I'd like to get a lot lower. We're putting through a participant service guarantee, and that guarantee will say that it has to be somewhere down about 8 weeks, so 7, 8, 56 days in that respect. And now to actually get access, we've dropped it down from 40 days to 10, which I'm very pleased, and even lower for children. The next step is from the access to the plan, and again, independent assessments will be the vehicle to drop that substantially lower.
I want to turn as well to the COVIDSafe app. When it was introduced, it was going to ping, if you like, or register, when two people were within 1.5 metres of each other for 15 minutes.
Yep.
Has that changed at all through?
No, the intent hasn't changed, the structure hasn't changed, and of course we've published the source code so everyone can see exactly how the app runs.
Because given 1.5 metres is social distancing at the moment, it would be pretty rare, you'd think, for someone to be that close to someone for that long who they don't know already, who you don't know well, and you can tell people who you're with. I mean, would it make more sense for the app to go off if you're 1.5 metres away for a minute, 2 minutes?
It may, but that's up to the public health advice. So the app was built based on the advice from the AHPPC, and if that advice changes, then of course the app distance or time can change.
But can you go to the AHPCC and say, well, we're not registering perhaps as many as we thought we might on these apps. What would 2 minutes do? What would 1 minute do? Because one sneeze, one handshake can pass on this virus.
I'm not saying you're wrong, Tom, but again, that's up to the medical advice. But technically, government stands ready to make any amendments it needs to based on the health advice to the app.
But do you go back and forth? I mean, I understand they have the health advice, but you can be curious as a human wondering how this thing works. Can you put that? Have you put anything to them about whether a change like that would make sense?
Absolutely. The Prime Minister, Health Minister and I often have conversations about this and where it sits and what more we can do.
So they're still... What's their response then? Have you put something like that?
Well, their response remains that 15 minutes is the advice, health advice, and until such time as the health advice changes, we'll keep the app as it is. It's just really important, I think, that we're health-led on this, that our response to the coronavirus isn't led by politics, isn't led by premiers or borders, it's led by health advice.
So and recent FOI report suggests, this goes to the sort of functionality debate of it, that 2 locked iPhones, which is a sort of natural state for an iPhone, right, once the screen goes black, would log a connection as little as 27% of the time under testing. That implies a pretty high failure rate.
So locked iPhones, depending upon whether the app's in the foreground or the background, depends on the version of the app and the operating systems, it's between 25 and 50% effectiveness. Now, that's got nothing to do with the app and everything to do with how Bluetooth works on an Apple device.
But that also implies a failure rate of between 50 and 75%. That's quite high, isn't it?
It is, but again, we're using a ubiquitous technology called an iPhone, which the government doesn't run the operating system or the handset. So it's, at present, it's operating to the highest degree we can get it, short of Apple and Google actually changing the way Bluetooth operates on their handset.
So the other push, and what some other nations are doing, is adopting technology that Apple and Google have. You can have things such as opt-out, so that if you get a version, for example, of the latest version on your phone, you're automatically getting this type of tracing software.
It's called the Exposure Notification Framework, which is Apple and Google's way of doing it. But what it does, it doesn't poll as quickly. We poll every 1 minute, it polls 5 minutes. They'll determine when the pandemic ends, as opposed to sovereign governments. And of course, it records close connections, and if you test positive, it will tell other people that you are connected to, hey, I've tested positive, but it completely excludes public health officials. And the way we've responded in Australia is that everything involves public health officials.
So this goes to the privacy concerns, basically.
It goes,
just put it neatly.
Not just privacy concerns, but if you followed the Apple and Google way, public health would not be involved in this at all, which means we wouldn't have picked up the plus 500 cluster in New South Wales if we were using Apple and Google.
Well, you might not have, but the individual users would have known they were exposed under that system, right?
They would have received an alert on their phone from the other phone they were close to, and then it's up to them whether they do something about it, as opposed to public health contacting you and saying, hey, Tom, we need you to come and get tested because of X, Y and Z.
So you think it wouldn't... I mean, you could theoretically have both, I guess, and if people get that alert, I mean, you'd still imagine most Australians, if they know they've been exposed, would do something about it.
The app was always designed to augment manual tracing as a core part of our response, and that's why involving public health officials in this notification process was so important to us.
Is there any ongoing discussion with Google and Apple that...
Substantial.
I mean, this is, 6 months into this pandemic. Are you going to get a breakthrough in terms of being able to utilise their technology better?
I hope so. I'd hope Apple and Google would understand that sovereign nations, and in fact the first 10 nations that created apps, there's over 34 now, that they were the ones that wanted to do things with their public health officials. And I would hope Apple and Google would realise that sovereign nations that want to use public health as a core part of the response, as opposed to just the individual citizen, that should be respected and Apple and Google should respond.
So you'd hope, but it feels as though there's an impasse if we're... I know you've mentioned, spoken about discussions before. Is there any concrete progress?
We're progressing.
Does that mean... Can you put a timeline on when you think something might
I wish I could, but I can't, but we're progressing.
Are you frustrated by their approach?
I'm frustrated that they haven't realised that sovereign nations have a right to exercise their own way of doing contact tracing and using public health officials, and they haven't actually then upgraded their Bluetooth capability to assist those nations. That is frustrating, but that's fine. We're using ubiquitous tech, we're using someone else's handset, so we'll be patient and we'll work with them.